Welcome guys, today we're going to be going over just like an introduction to beginners breath work. So first we're going to talk about, I'm sure all of you guys know someone who has allergies, asthma, stress, anxiety, anything like that. Just from the way that typically people breathe nowadays, which is through their mouth versus their nose, and typically how we breathe, and a couple other factors which we won't dive into in this video. Our society typically isn't very good at breathing, full of stress, anxiety, right? Most people can't even breathe out of their nose because they're too congested. And with that, learning to breathe from your nose can have a great impact on your life, and not just by being able to breathe through your nose. Breath work and just focusing on your breathing can have a variety of different impacts on your life, including lowering your blood pressure, your heart rate, stress, anxiety, and just overall health and feeling better. For me personally, about 2 or 3 years ago, I used to have my nose plugged up all the time, at least one out of the two, as well as when I went to sleep, it was impossible for me to breathe through my nose, and I hated it. So eventually I just started going, and I started trying to breathe through my nose, and just eventually there came a time after doing that, even though I couldn't at first, where my nose was clear, and since then I can breathe freely through my nose. No problem. I'm never congested, never stuffed up, never really have any allergies or anything like that. So my goal with this is to teach you guys kind of what I started out with and what I started to kind of get the results that I have, as well as along with the books that I've read. They've showed that they can help with asthma, panic attacks, just a lot of different things. So essentially we're going to see here, I want you guys to join along, ideally daily, and just do these routines daily, hopefully for a month. Feel free to keep going, especially if you're having good results. But you got to do it more than just like a week or so, right? 2 weeks maybe you start noticing something. But anything takes repetition, takes pattern. So we want you guys to commit to it. And remember, it's for your health. It's going to have a long-lasting impact on your life. So first off, what we want you guys to do daily. Daily, there's going to be 3 main things that we're doing daily, and they all kind of go together. We're going to teach you guys to nasal breathe, diaphragmatic breathing, and then the pace that you breathe. So for nasal breathing, it's quite obvious. Breathe through your nose. A lot of you guys may not be able to right now, so what I want you guys to do is as much and as often as you can, just focus on breathing through your nose. There's a little saying that says if you're not talking, keep your mouth shut. Obviously, if you guys are having too difficulty breathing through your nose is too stuffed up, that's not possible at all times. Just dedicate times throughout the day to really try and spend time trying to breathe through your nose. And then just focus on times when you're not doing much. So say like you're sitting, you're watching TV, really focusing on breathing in through the nose, which may be very difficult at first. While you're watching TV or something, you may notice that if you can't get any air through your nose, what you can try to do is just kind of take your nostril and pull it out to the side. And sometimes that'll open up your nasal cavities. Through years and years of mouth breathing, our nasal cavities get underdeveloped, the muscles and structures in there kind of atrophy, our cavities kind of close down. It makes everything very stuffed up. So sometimes you can open it up. That's what I used to do originally, and that'll kind of help you be able to breathe in through your nose sometimes. And then obviously, as time progresses, preferably try to do that less and less. So for diaphragmatic breathing, it's one of the best things you can do. It's how we're supposed to breathe. Our diaphragm is meant for this. What people do is they'll breathe more with their chest, which is more your accessory muscles, which is why you get a lot of neck tightness as well. But essentially what you can do to find out what kind of breather you are is you can put one hand kind of on your stomach, so not really at your waist, a little higher, like right below your ribs, another one on your chest, and then just take a couple breaths in, just natural breaths, whatever your normal is. And feel which one, either your hand which hand, so either on your chest or your stomach, rises more. They may both rise, which is perfectly normal. That's what we want. But the goal is to have more of that motion coming from here. Typically, they call it belly breathing just as a cue. It's not really just our belly. It's our diaphragm pulling down and expanding this area. And if we really think about it, what we want to do is expand circumferentially, like 360 degrees this way. And that's what we want to do as we fill our lungs with air. So a good way to practice this is just to dedicate time to it if you're not already doing it. If you are, and can start nasal breathing. You'll notice that nasal breathing kind of biases you more to using your diaphragm, in my opinion. But if you notice you're doing a lot of chest breathing, that's not what we're looking for. What we want is this bottom hand over our kind of stomach area as we inhale. And that's really what we're looking for with diaphragmatic breathing. So if we combine our nasal breathing, diaphragmatic breathing, and then a slower rate of respiration, which we'll talk about next, that's what we're looking for, our all-day, everyday breathing style. So along with trying to breathe through your nose at all times and trying to breathe through your diaphragm versus your chest, once again at all times throughout the day, the last thing we're going to be doing is kind of the pace of breathing. So typically most people overbreathe when you have an asthma attack, panic attack, anxiety attack, anything like that, right? Your breath kind of increases, you start kind of hyperventilating. That decreases the carbon dioxide in your body, as well as most people typically already have a decrease of carbon dioxide in their body just from mouth breathing and overbreathing. And they've shown research that having normal levels of carbon dioxide in your body will actually help with those things and normalize your respiration and kind of calm you down, as well as your body actually needs carbon dioxide to release the oxygen into your body. So if you're not having that carbon dioxide, if you're having too little, there's going to be consequences with that. So, and this won't come right away. At first, it's going to be very conscious of you. You have to focus on it, and then eventually you'll notice that your respiratory rate has slowed down a little bit. So what typically I'll tell people is to start with between 5 and 6 seconds. So a 5 and 6 second inhale, and then a 5 to 6 second exhale. Most people struggle a little bit more with the exhale. So if you do have trouble with that, you can start a little lower, say like 4 seconds in, 4 seconds out, something like that. Still trying to breathe through your nose at all times, but essentially you just be breathing in and then breathing out. And it's not like you're trying to breathe air in real fast or push it out real fast. It's just normal, calm, relaxing breathing, trying to take your time, very little. Slowing down your respiration is going to help increase that carbon dioxide in your body. It's going to help you overall remain calm, and it's just going to help you with that. So those are the kind of the 3 main aspects of breathing that we want you to focus on every day, all throughout the day, as much as you can. The more you're able to do it, the better and faster your results will be. There are 2 different things that I would recommend doing daily. The first is taping your mouth at night. Although this sounds extreme and crazy, I first did this and it worked real well. It helped me really try to breathe through my nose. You also wake up in the morning feeling so much better. Right? Everyone always tells you breathe through your nose with exercise and things like that. You're going to oxygenate your body better. Your body will use the oxygen better through your nose because it humidifies it, it cleans it and everything. So when you're sleeping at night, if you breathe through your nose, I guarantee you will wake up feeling much more energy in the morning. You'll wake up feeling better. So I'll take just a piece of regular tape now. At first I started off with like kinesio tape or some sort of breathable tape and put it over your mouth. They make strips to put on your mouth that are for this specific reason. I'll try to find them and put the link in the bio. But if not, just use a piece of tape. Any type of tape works, just whatever you're comfortable with. I currently take like tape and just put it across my whole mouth. If you're using breathable tape, it's a little nicer because in case you do want to breathe a little bit through your mouth, you have that option. Or you can just take a little piece of tape, put it right here in the front so that you can still get air in and out through the sides if you need. It sounds crazy, but it does work and it makes you feel a lot better in the morning, and it will help you get on that kind of nasal airway breathing pattern and to kind of help really build it into a habit. The second one is just spending about 10 to 30 minutes a day, just depending on how much time you have. I'd say do it if you're watching TV, if you're just sitting at your desk, something like that. But working on inhaling and then exhaling, but at a different cadence than what normal is. And this is just to expand that exhale, which is going to help you guys a lot as well. but it's going to be an inhale of say 3, 4, 5 seconds, and then an exhale of double that time. So whatever you started with, and typically start with a lower number and build up to 6 or 7 seconds for the inhale. But at first, you're going to start off with 3 seconds, an inhale of 3 seconds, and then an exhale for 6. Inhale for 3, exhale for 6. Keep that going for 10 to 30 minutes. A lot of people have difficulty with the exhale, and that's okay. If that's you and it feels like a struggle, and even when you're doing like the lower 3 seconds inhale and 6 seconds exhale, if that's still a struggle, you can try something else called box breathing, which is inhaling for 4 seconds, holding for 4, exhaling for 4 seconds, and then holding for 4 and repeating that cycle. So you just inhale, so I do prefer just doubling your exhales compared to your inhales, but if you can't do that, box breathing is another great way just to kind of help you relax and kind of work on your breath work. Any sort of this breath work, just slowing down your breath work, especially just the 6 seconds in, 6 seconds out. I really want you guys to focus that all throughout the day like we've said, but also before meals, it's going to help stimulate your parasympathetic nervous system, aid with digestion. Anytime you're feeling anxious, anytime you have any anxiety or stress, just really focus on slowing down your breathing and relaxing. I think that'll help a lot. Last but not least, we have 2 little bonus tips to throw at you guys. One is just posture, right? It's much harder to breathe if we're kind of hunched over like this. So we want to kind of open up our chest, sit up tall, have our neck back so we're not, forward like this. It's just going to help with our breathing posture overall, so it's something that we can work on. The other thing is, while you are eating, 1, chew much more often than you think you should. It's going to help break down the food. It gets more saliva into the food, it helps breaks it down. And then as well, it's going to kind of work on your jaw and your chewing muscles. And then I always tell people, which I've started doing as well, just chewing things that are a little bit more firm or hard, such as like cashews, any sort of nuts, raw vegetables, beef jerky, things like that. As we've progressed in history, right, we've been able to cook food, which makes it softer, which means that we didn't have to chew as long for our food, which is great. But most people, if you look through the skulls, just kind of as humans have developed, our jaws have gotten smaller, our mouth's gotten smaller, and things like that. So this can kind of help just kind of regain some strength, some muscle in your jaw, which will help along with your nasal cavities as well. So just kind of keep that in mind. It's just another little tidbit to throw out there. But remember, this is just kind of a beginner video. It's very basic. What I'm hoping is that you can notice good improvement if you stick with it and stay committed, as well as just to kind of spark your interest in what breath work can do for you. But if you like it, let me know in the comments. Send me messages personally. Let me know your progress. I'd love to hear it. I'll make more videos on other breath works, as well as if I get enough, what's the word I'm looking for? If we get enough interest in it, we may even make a course diving more into the different types of breath work, the more advanced techniques that I like to use as well, and we'll see how it works. So give it a try. Don't forget to subscribe so you don't miss any more videos, and we'll see you guys next time.